So we're going to start learning the path of blood flow, all right? And I talked about this in the lecture side of the class too. So when it comes to the path of blood flow, blood just goes round and round and round and round. So you can really start at any point. You could start here and do the whole thing, or let me do yellow. So remember, blood just goes round and round. But by convention, we usually start right here at the right atrium. So blood's going to go from the right atrium into the right ventricle. Then it's going to leave the right ventricle and go into the pulmonary trunk, pulmonary arteries. Then it goes to the lungs, drops off CO2, picks up oxygen, comes back in the pulmonary veins. Then it goes into the left atrium. From the left atrium, it goes into the left ventricle. From the left ventricle, it's going to go out through the aorta. Then it's going to drop off oxygen everywhere in the body, down in your little toes, and then it's going to come back through the vena cava and go to the right atrium. All right? Now, I am going to recommend that as you are studying the parts of the heart, that you study them in the path that blood takes, because that'll make it easy for you to do the two things at the same time. So when you're in lab, study the parts as you're thinking about the direction that blood will go. Okay, let's see. One thing that we didn't do the first time that we went through there is we didn't talk about the valves. Let's add the valves, okay? So from the right atrium through the tricuspid valve into the right ventricle, then from the right ventricle, it's going to go into the pulmonary artery, so it must be going through the pulmonary valve, then out to the lungs, pulmonary lungs, comes back in the pulmonary veins, into the left atrium. From the left atrium, it'll go down into the left ventricle by going through the bicuspid valve, which is also known as the mitral valve. And then it's going to leave the left ventricle into the aorta by going through the aortic valve. Then it goes out, drops off oxygen, comes back through the vena cava, and you're back where you started out. Right? So now over here on the left side of the slide, everything is not quite as anatomical, but it's more of a schematic, but it's the same concept. So blood starts off here in the right atrium. Let's see, what color is good? Here in the right atrium, great. And it's going to go from the right atrium into the right ventricle by going through the tricuspid valve, from the right ventricle into the pulmonary arteries by going through the pulmonary valve, picks up oxygen and drops off CO2, comes back in the pulmonary veins. Oh, look, the blood is red because it is high in oxygen, low in CO2. Then it's in the left atrium, goes from the left atrium to the left ventricle by going through the bicuspid valve, also known as the mitral valve, from the left ventricle into the aorta, drops off all of its oxygen. Now, when it comes back, it can come back from three different areas. The superior vena cava, we know that. The inferior vena cava. The one part that might surprise you is the coronary sinus. Ooh, have we talked about that yet? No, we're going to talk about it now. So the blood vessels that are sending blood, oxygen to all of the cells of your body, those arteries, most of them branch off the aorta later. But the very first blood vessels that branch off of the aorta are these guys, the coronary arteries, like this little guy right here, this little guy right here. I want you to notice that in order to see the left coronary artery, we actually had to cut away this pulmonary trunk so that we could show you the left coronary artery. You know, blood inside of the left atrium and the left ventricle is really rich in oxygen. But if there are not coronary arteries bringing blood to the muscle of the heart, all of the oxygen in there will not keep the heart alive. You need your coronary arteries to be working to deliver oxygen to the heart. So there are two main coronary arteries that are delivering oxygen to the myocardium, to the heart muscle. And the right one goes over here by the right atrium, and the left one goes over here. It dives under the pulmonary trunk. It's over there by the left atrium. When someone has a heart attack, it's usually because there is an obstruction in one of these arteries. And if the artery is obstructed, it's like someone plugged a pipe bringing water into your house. If the pipe gets obstructed, then the oxygen can't be delivered. And if the oxygen can't be delivered to the muscle of your heart, that heart muscle will die, and that is called a myocardial infarction or a heart attack. Right? Now, the arteries are called coronary arteries. The veins, for reasons that I do not understand, are called cardiac veins. Coronary arteries, cardiac veins. I apologize for the world of anatomy. Okay. Why can't they just call them both coronary or both cardiac? I don't know. But on the back side of the heart, there's a spot that you really need to know for your lab quizzes. And that's this big bulge there. That bulge there on the back of the heart, this is the back of the heart, that is called the coronary sinus. And all of the blood that has dropped off oxygen to your myocardium is coming back in these cardiac veins, and it is dropping it off in the coronary sinus. Blood from the coronary sinus will also go into the right atrium. So this is the back of the heart. So here's the superior vena cava, the inferior vena cava, and the coronary sinus. Okay? All right, let's talk a little bit about blood pressure. Blood pressure is the force of the kind of pressure that blood is under inside of your blood vessels. And we measure it at what are called the great arteries. So you can measure it at the aorta, but we usually measure it out here at the brachial artery. Remember the brachialis muscle and the biceps brachii and the triceps brachii? So by now you know that brachial has something to do with the arm. So the brachial artery, that's usually where we measure blood pressure. We don't have to, though. You can measure it in the leg. And if someone's like in the ICU, very often it is measured at the leg. Okay, so the brachial artery, and it's how much is being pushed back. You're going to learn that there are 3 factors that influence blood pressure. It's how fast the heart is beating, which is cardiac output. It is also the blood volume, how much blood you have. If you lose a lot of blood, your blood pressure goes down. And then it is also something called vascular resistance, or how big the blood vessels are. Every blood pressure measurement has got 2 numbers. The first number is systolic, and the second number is diastolic. Okay? So what we mean by that is the first number is the pressure that we measure when your ventricles are in systole. When your ventricles go whoosh, then this big pulse of blood whoosh, goes out into your arteries, and that'll cause your blood pressure to go up for a second. And then when your ventricles are in diastole, there's no pressure in your ventricles, then there's a rebound moment. So the blood pressure during systole is higher, and it is the first number. The blood pressure during diastole is lower, and it's always the second number. So if your aunt tells you that her blood pressure is 110, you don't know whether that's really good or really bad because blood pressures always have 2 numbers, right? By the way, when you feel your pulse, what you're feeling is your blood pressure go up and down and up and down. And that little bump you feel on your fingertips, that's your artery stretching with ventricular systole and rebounding with ventricular diastole. Okay. Now, I want you to know what high blood pressure is. So this is a number that I will ask you to memorize, that the boundary for high blood pressure right now is 130 systolic or 80 diastolic. Now, honestly, if I ask you to run around the building and quick come back and measure your blood pressure is going to be that high. That doesn't mean you have high blood pressure. Hypertension or the health problem of high blood pressure is when you're resting, like I've been sitting in a chair for 5 minutes doing nothing. When you're resting, blood pressure is chronically or typically 130 systolic or 80 diastolic or higher. All right. So I want you to memorize that number. When I started teaching physiology, it was higher. It was 140 over 90, but now it's 130 over 80. High blood pressure will destroy the tiny arteries of your body. It damages your kidney. It makes your heart work so hard that your heart starts to get damaged and it never gets a chance to rest and repair itself because your blood pressure is too high, even when you're asleep at night. Because of the damage it does, particularly to the small arteries, it is a cause of blindness and heart attacks, and it causes a problem called an aneurysm. So make sure you memorize it. All right? Okay, I think that's it. When we meet in lab, if it's not COVID time anymore, when we meet in lab, we will be learning how to measure each other's blood pressure. All right, that's it. See you in lab.